But again, thank you guys for joining us. Hope you all are doing well. Again, we're on our last case of the day. We're doing our patient is having a BBL done. They're having lipo 360. They are also having a tummy tuck. So we went ahead and did some lipo on our patient's backside first. And then we went ahead and did the BBL as well. It's a really quick process. Then we went ahead and flipped our patient, so we usually, I'll step out of the room for that. Takes a little bit of time. So we went ahead and flipped her over, and then we got started on the tummy tuck. So what that looks like is well, I don't, but one of our surgeons make a long incision hip to hip. And what they'll do is they'll take these really interesting tools that are really hot, and it's kind of like zapping the skin, and it helps to deepen that incision, so it goes all the way through that fat down to where it rests on our patient's stomach. So once they get to once they begin separating and deepening that incision, they'll start kind of almost peeling back the skin and the fat, and continuing to separate the fat from resting on the stomach as far back as they need to. And then it's kind of going to look like an upside down T. They make another incision from where they made the first incision, but going up to the belly button, so straight up. And then what they do is they cut the excess skin that's undesired, and then they re-stitch it back up to give a more tight, lifted look. So again, if you guys are interested in that procedure yourself, or are interested in seeing it, you guys can join us on our YouTube here at Dr. Jeneby Plastic Surgery. We do have some people watching. The camera is flipped, so you guys are able to see our surgeon. You guys are able to see the surgery happening. I definitely recommend joining us over there. Again, it's going to be at Dr. Jeneby Plastic Surgery. If you guys have any questions, that's what I'm here for. Comment them down below. Be happy to answer those, or we can have Dr. J answer them as well. Yes, again, we're on our last case of the day. We are doing a we are doing a tummy tuck. We are doing a BBL, and we did some lipo 360. We're also live here on Dr. Bam's TikTok, just to give some of his followers a chance to tune in as well and to ask any questions if interested. So right now, Dr. J is injecting some Exparol, which is like a pain injection, if you will. It helps numb the area. It's long lasting. It lasts about 3 days. So we just went ahead and did that.
Oh, okay, I'll do that. Yeah, just to tell myself. But I figure, you can help me with the big one. The big case will knock out. Yeah, that's fine. I'm cool with it. Good idea.
And again, for those of you just hopping on, we are doing a tummy tuck on our patient. We were live earlier. We got started on some lipo 360. We were live for a little bit of that, And then we took a little bit of a break to flip her over, and now we are doing the tummy tuck. So we already made that incision, hip to hip, so right along her lower abdomen.
Play Breaking Benjamin Radio.
And we already separated where the skin rests on the stomach. We already peeled that back a little bit. And here shortly, we're gonna remove some of that excess skin. And again, like, if you guys have any questions about today's procedures, about some other services we offer, I would be more than happy to answer those for you.
I know who he is. Who's Bob Moses? Oh, come on. Alexa, play Bob Moses.
Here's some music by Bob Moses on Amazon Music.
This is a real popular song. It's with Overbrock and Bob Moses. Oh, okay. I know. I've heard this song. I didn't know.
And we are live on YouTube as well. So if you guys want to see the camera flipped, see our surgeons, and see our patient surgery, you can join us over there at Dr. Jeneby Plastic Surgery. We go live there not as often as we go live here on our TikTok and Instagram, but that's just because it takes a lot more consent. It's more vulnerable. It's obviously showing the patient themselves. And some people don't want that, but then some of our patients do want that. Even for their friends and family, loved ones, you know, they like to tune in and watch over them while they're in surgery, which is really interesting. It's very common, actually. Hey Alex, thanks for joining us there on our YouTube. Welcome. And then we are also live here on our TikTok at Dr. Boom Boom Pow for those of you who are with us on YouTube. And again, we are doing a tummy tuck today. We are doing lipo 360 and a BBL. So we were live for a little bit earlier. For the first part, we did some lipo on our patient's backside. So we had her lying on the table on her stomach, and we did some lipo on her back, on her sides, and in those areas where she didn't want fat, basically. And what we do is we kind of collect that fat, and then when we're ready, we use some of the fat that we held onto and inject it into her butt, and then that kind of concludes the BBL process. Then we took a little bit of a break so we could flip her over, so flip her onto her back side and finish up the tummy tuck and the rest of the lipo. Hello. And we always start on the back side of our patient. So if they're having like I said, like if they're doing a butt lift, we will always go in and do the butt lift before we go in and do like their breasts. Say they're getting a tummy tuck like our patient is today. Like we would always do the butt first if they're paired together in the same day. And that's just because it's more dangerous. It's a lot more vulnerable than the backside when we put so much pressure on it right after operating there and like making those incisions and stitching it up. So we like to always start on the back first, which is interesting. But it kind of makes sense if you think about it, because those areas on the front are a lot more vulnerable. Like if you were to get your breasts done and things like that, you definitely don't want to be putting pressure like that. You really don't want to be putting pressure on your butt, on your breasts at all while you're in the healing process. You want to limit as much pressure as you can. Right after surgery for about 2, 3, 4 weeks. And then, of course, after that period, you still want to be gentle with yourself and allow your body to heal.
Monaco? Or is that mine? Oh, Monaco, right?
And again, we're live here on Dr. Bam's TikTok as well. So if you guys are joining us here on YouTube, you can check him out. Again, it's at Dr. Bam. And then as well, we are live with Dr. Boom Boom Pow on our TikTok as well. And we are on our last case of the day. Again, for those of you just getting on, we are doing a tummy tuck currently. Earlier we did some lipo. We're doing lipo 360. So we got started with some lipo. We were live a little bit for it in the beginning, then we took a break, and now we are doing the tummy tuck right now. And I'm here to answer any questions you may have about that, what that looks like. If y'all are ready to take the next steps in booking your surgery and booking your consultation, we do have forms pinned here on the bottom of our page. You guys can click on it. You guys can fill it out, and then somebody from our team will reach out to you, help you set up your consultation, give you all of the details when it comes to what to expect for post-op, pre-op.
Maybe like 30 minutes or less. Where is she, down here? Okay, I'll be there.
Hey everybody there on our YouTube. If you guys have any questions, feel free to comment down below. We're doing a tummy tuck currently. Earlier we did some lipo 360 and we are doing a BBL. We're live here with Dr. Boom Boom Pow on TikTok if you want to go and join us over there as well. And we're also live with Dr. Bam. Again, hope y'all are having a good Wednesday. This will be our last case, so that means it's our last live of the day. We'll be live later this week and next week as well. So tune in for those if you're curious, if you want to ask more questions, you want to see what we're doing over here at Chrysalis or Maximus. We go live a couple times a week. So we are always here, we are always ready, and we are always answering people's questions. And we are in San Antonio, Texas. So we are located in the Stone Oak area, if you're familiar. That is northern.
4 millimeters below.
Oh my. Wow.
You like that, McKenna?
No. That's a lot.
Here's you.
It didn't scare me, it was just, wow.
4 below. Yeah.
So we just went ahead and removed some excess skin from the tummy tuck that we are doing. Hello. Again, we are doing our last case of the day currently. So for our last case, our patient is having a tummy tuck done, a BBL, and lipo 360. So earlier we did some lipo 360, we did the BBL, and now we are finishing up that that tummy tuck. Hey there, Maria. Awesome. Would love to see what he's doing. Yeah, absolutely. We're actually live on our YouTube if you want to go join us over there. On our YouTube, we flip the camera and we're able to show the patient and our surgeon. So if you want to join us over there, it's going to be Dr. Jeneby Plastic Surgery. Let me know if you have any issues finding it. We'll be live for a little while longer. Yeah, of course, Maria. And let me know if you have trouble finding it. Come back here and I can help you. Again, it's going to be Dr. Jeneby Plastic Surgery. It should show that we're live. And then you can, you'll also see some other surgeons' names listed on there. You'll see Dr. Bam. You'll see Dr. Latin Heat. So let me know if you find it, and I will see you. You're gonna search Dr. Jeneby Plastic Surgery on YouTube.
Would you bring a seat?
Pizza lasagna.
Oh yeah, I love that.
Or you can click our link
Sisters
tree.
up there.
I heard.
You can click our link tree, and in our link tree, it should be linked there. You might have to scroll and look for it. We have a lot of things. We have our get a quote button. We have our website link there. But it should be there as well. Or you can try to find it at Dr. Jeneby Plastic Surgery. Again, let me know if you have any issues or you need any help with that.
Drain, you'll have to wait till the end to pull it up.
Again, we are on our last case of the day. So we are doing, for our last case, we are doing a BBL, we are doing lipo 360 and a tummy tuck. So earlier we were live for a little bit. We did some lipo 360 on our patient's back. And then we went in and did the BBL. So now we are finishing up. Hey Shannon, thanks for letting me know.
Don't move. I got fooled by infiltration. That's bad.
Now you know how to do that.
Lipo. I didn't lipo this because
Hey Shannon, thanks for letting us know there on Dr. Bam's. Let me try to turn it up a little bit. Let me know if the quality improves.
extended, but I had a small dog here.
Again, we're on our last case of the day. We are doing a tummy tuck. We did a BBL, and we are doing lipo 360 for our last case.
Hernandez and Alex are tricked me. Tricked you or tricked me? They tricked me. Oh. After I vote, and I said, all right, go eat, so we can get to the next case. And I went, what next case? This is the last one in here. And then they're like, no, there's another tummy tuck brachio to follow. I'm like, no, there's not. There's 3 cases today, 1 canceled. And then they're like, no, both, and Hernandez agreed. I was like, what? So I came out there and I was dating. I was like, that's all the cases, right? And I was like, yeah. It ticked me. It ticked you 100. All right, guys, we're going to close up. Thank you guys for watching. Don't forget our July specials. What if we just...
All right, you guys heard it. We are going to end things here. Thank you guys for tuning in. We'll be live later today. Hope y'all have a good one. If y'all are ready to take the next steps, we guys have we have that form that's pinned here. You guys can fill it out, and once it's submitted, somebody from our team will reach out to you. Again, thanks for joining us. We'll see y'all next time.